Health is important to everyone. On average, people's health in Europe continues to improve. But this average hides very big gaps. Even in the same town or city, poorer people or those with less education may live 5 or more years less than those who are richer. And between the regions of Europe, the gaps are even bigger. This map shows life expectancy for men for EU regions. The gap in life expectancy between some regions is between 6 and 18 years. For women, the gap is between 4 and 15 years. Why is this? What can be done to improve the situation? And what can the European Union do to help? First, we asked Sir Michael Marmot, Professor of Public Health and Chairman of the much-acclaimed World Health Organization Commission on Social Determinants of Health.
Inequalities in health do not arise primarily because of inequalities in the healthcare system. The inequalities in health arise because of the conditions in which people are born, grow, live, work, and age.
We decided to look at 2 different parts of Europe, wrestling with the problems of health inequalities. First, we go to Estonia. Like many other countries in the eastern part of the European Union, Estonia has experienced huge economic and political changes in the last 20 years. It has ambitious plans to modernize its economy and social and healthcare systems. Health is one of its major concerns. Estonia wants to close the gap in health between it and the rest of the EU and to reduce gaps in health between rich and poor in its population. We started by talking to children's specialist Dr. Mari-Liis Ilmuie to ask why Estonians have a lower life expectancy.
The main problems in people's health were mostly alcoholism, reckless driving, and nowadays, again, when a lot of people are getting unemployed, probably the incidence of suicides.
So what we can easily see are behaviors such as smoking, drinking, and careless driving. But behind these behaviors can be unemployment and poor living conditions. Where does education fit into this picture?
What we have seen in the studies that lower education is very much related to risky behavior. We see much higher numbers, smoking and alcohol and drug abuse among people who have lower education.
In some countries in Europe, the health of people living in the countryside is much worse than that in the city. There are still parts of Europe where many houses don't have mains water or their own toilet. In such conditions, it's not surprising that health is worse. So is the problem just lack of money? We go to London, by some measures, the richest city in the European Union. But there is a difference in life expectancy in the different neighborhoods of London. Research shows that life expectancy goes down by 1 year for every underground station you stop at from Westminster to Canning Town. So traveling down to the poorer east end of the city, you can see that the people there live shorter lives.
When people think about health inequalities, though, they usually think of poor health for the poor, the poorest of the poor, and everybody else having reasonable health. That's not what the evidence shows. The evidence shows this remarkable graded phenomenon. The higher the affluence level, the better the health and the longer the life expectancy. The greater the deprivation, the worse the health, the shorter the life expectancy. And it's a remarkably graded phenomenon. And that means if we really want to tackle health inequalities in society, we've got to tackle the whole of society. We can't just focus on the poorest of the poor.
In the last few years, the UK has made a huge effort to reduce health inequalities with actions at national, regional, and local level. Ray Earwicker from the Department of Health in England.
people making choices about their own lives and their own health is absolutely important. But it does need to be supported by an infrastructure of social determinants. So I've talked about poverty, but equally things like education, housing, environment, these are all important factors. The best sort of services tend to be in the areas where people have the best quality of life. There are more doctors in more prosperous areas as opposed to less prosperous areas. This is a structural problem that we're seeking to address.
It's clear that health inequality is an issue for the poor. But it isn't just an issue for the poor, but for society as a whole. So what more can be done? Making this film, we heard a lot about what action governments are taking to improve health, improving living and working conditions, addressing health-related behaviors, and developing health and preventive services. What about action at European and international levels? Can that help?
The Framework Convention of Tobacco Control, which has brought for us a very good tobacco law where the tobacco advertisements are not allowed, and also in the it has brought clean indoor environment into the pubs and restaurants, and it's a very good policy thing.
The European Commission has set an ambitious agenda to tackle the health inequalities within Europe and to raise solidarity in health.
I am very, very concerned that there are so much inequalities amongst various social groups in Europe, various ethnic groups in Europe, and also various people with different incomes. Poor people should not suffer poor health. The fact that the social reality of individuals and groups is a main contributor to these inequalities. Therefore, the European initiatives to redress social problems and social issues go also a long way in redressing these health inequalities. All the decisions that are taken within Europe have an impact on health, and we have to make sure that these decisions are not impacting badly, negatively on health. On the contrary, that they are having a positive impact on health. The people have to be at the center of everything. And I believe this has to be translated into a social policy that ensures the cohesion and the momentum that has to increase towards people living a better life.
We cannot help but think of the very different living conditions that exist across Europe, of the gaps in life expectancy that go along with them. At first glance, these aspects seem to indicate an impossible gap to close.
My optimism is evidence-based. We called the report of the Commission on Social Determinants of Health Closing the Gap in a Generation. So we implied that it's not going to happen overnight, but we have to start now. Closing it in a generation implies let's start with today's girls who are going to become women, who are going to become mothers, and boys who are going to become fathers.
Bridging health inequalities requires joint action by many players, many stakeholders, including the college itself, but also member states especially, and all the various people involved in the delivery of health. I am confident that by working together, we will ensure that all European citizens will have better health and will live a longer, healthier life.